Hey faculty, this is Laura. I am going to run through what simulation is going to look like for this week, week 11. We are doing a, combo sim this week with S1 and S2 students together. This there's two activities, I guess, this week. One is a prioritization delegation simulation, and then there's also going to be um an activity that's going to focus on the principles of sterility. The students still are having some difficulties with that, and so rather than just going over the skills, practicing the skills one-on-one like they have been doing, we're going to do something a little bit different where they're going to do almost like a, I don't know, obstacle course relay race kind of a thing together in their groups. And some of it's going to be hands-on actually doing some skills, and some of it's going to be some questions that make them think critically about the principles of sterility. So we're going to try that kind of an activity and see how they do with it. So let me walk you through what's going to happen. I'm going to talk about the simulation first. So this is what the simulation looks like. There are a lot of moving parts to this, and it requires a lot of people to carry this off. I will say the first thing, let me say to you, is this. Please, please, please make sure that you arrive 30 minutes early this week, because we've got a lot of CTAs helping us as well, and they don't get all the prep work. So we have to be there so that we can walk them through all of the things and what we need them to help us with this week. And so we all want to make sure that we're there early talking through what needs to happen. And it's very time dependent this week, so we can't start late and get off of the schedule, or it's going to throw everybody off, all of the different pieces off. So let's just start with that. So here's how this is going to work on the simulation. This First of all, it's going to assess prioritization, delegation, med safety, and clinical interruptions. We've thrown clinical interruptions in as well, because the students don't really get a chance to ever play with that and see how that actually works in simulation. So the S1 students are going to be the primary nurses caring for the the patients. S2 students are going to start out with them, helping with them to prioritize, and then they're going to take the role of PCTs and charge nurses and help with the whole delegation piece. So the way that this is going to work is that there's kind of three phases in the simulation. First, the S1 and S2 pairs are going to come in, and they are going to receive report on 3 patients. The students are going to analyze their data, determine which patient requires immediate attention, and give their rationale for that. Then, based on how they prioritize, first of all, each student pair will receive a different report. It's all the same 3 patients, but each pair will have a different report that prioritizes a different patient. So pair 1, it might be patient B. Pair 2, it would be patient A. Pair 3, it would be patient C. So the patients are the same, but what's going on with them is different according to the report they receive. And so they're going to prioritize their patients. If their priority's off, then the facilitator who's giving the report to the students will say, "Oh, let's rethink that. Tell me how you came to that," and then help them analyze their way through their prioritization, so that they don't try to go see the patient who's not their priority patient, because the other 2 groups are seeing those patients. So once they do that, then they will go into their actual patient care area. So the S1 student will go to their patient, and they will start to see their orders. They will start to get their medications together and perform the procedures. The S2 students will then come back, and they will be ready to be delegated to. So while the S1's in there in the room doing a focused assessment, getting the medications ready, which by the way, there's an embedded error there that they should catch and need to recognize and know who to call about that. And doing all of that, the CTA or the facilitator who's at the nurse's station, they'll be at the nurse's station and they have interruptions that they are going to be presenting the students with. Like, for example, oh, you have a phone call, the doctor wants to talk to you. And this S1 student's going to have to determine, is this something I can delegate to a UAP? And if so, they would call out and say, I need my S2 student who is the UAP. I need you to go handle this. And they would delegate that to that. Or I need my S2 student who's the charge nurse. I need you to go handle this. And they would delegate it off. Or they might decide, this is not something I can delegate to anybody. I'm going to have to deal with this and it'll have to wait until I'm finished in here. And those are their three options. The S2 student will take their delegated task and go to the facilitator at the nurse's station and say, I have been delegated this task by my nurse, and it was appropriate to delegate to me because of XYZ. And here is how I would now do this task. Here's the actions I would take. Or they would come and say, I have been delegated this task by the nurse and it was not appropriate. And here's why X, Y, and Z. And here is what I would do in order to handle this situation. So that's what the S2's responsibilities will be. Once we get through this part of the scenario, and there's 30 minutes to do it, that is a hard time. And so whatever gets done within that 30-minute period of time is just how the scenario will end. Once they finish that, they will then go into debriefing. And they will then debrief about the priority, how that came about, the medication error, how they delegated, all the different things that have happened. In the rest of this packet, you will see, so here's pair one's scenarios. Here's how it gets prioritized and why it's prioritized that way. So here's your key. If you're the faculty member who is, for example, in room B, this is what you need so that you will see this, you will see why it was prioritized that way, and you will see the orders with the key here, and you'll see the interruptions and how it can be delegated. If you're the facilitator for patient A or room A, this is your key for that. If you're the facilitator for room C, this is your key for that. And then, excuse me while I scroll down. If you're debriefing, here are your debriefing questions here. I think that's all for that. Very quickly, I'm going to go through, if you're working in the skills lab, this is the obstacle course here. And what's going to happen here is there's 4 stations in the obstacle course, so that 4 are in that room, so that 4 groups can go at a time. Within each group or within each station, there are 6 activities. So 6 students will be at each station, and there are 6 activities. So 1 student per activity. You can see, for example, like the first activity, open 3 sterile gauze packages and drop it onto a sterile field in 30 seconds. And so what you're watching for is, number 1, you time it, and number 2, did they break any principles of sterility while they were doing that? The other students will also be watching. They're looking to see, did they see any breaks in sterility as they're doing that? And then you would move to the next activity, which is answering these questions about principles of sterility. So the next student would then answer these questions. There is a point system here. As a facilitator, you can choose to give the points here, and they can kind of compete against the other groups to see who comes up with the highest total points. But you're just going to go through each of these 6 activities, and you've got the key here as well. I think that's the biggest thing here. The students have access to this, so they should be able to come prepared, knowing what to expect. Um, and this should take about an hour. Afterwards, after they've done all six, oh, sorry, it cut me off. After they've done all six activities, you should then debrief all four of the groups together and just talk about, and you've got some debriefing questions here to talk about all of the, like, what things were difficult for them, what questions did they have, like how was it for them having peer monitoring, different things like that. And you've got some key teaching points here as well. So I think that's all. um we've got a lot of CTAs helping us this week as well, so especially in this area here. So just help kind of go over this with them so they know what to expect. I think that's it. Thanks, y'all.